Hello, I'm Dr. Nicholas Cohen, and I'm here to share with you a top 10 list of tips to identify, prevent, and manage sleepwalking in your child. Tip number 1 is to recognize when your child is sleepwalking. First of all, understand that sleepwalking is very common. It occurs in up to 15% of children. Usually it starts between age 5 and 10, and it's most common between age 8 and 12. During sleepwalking, your child's eyes will be open, but usually his or her face will not have an expression on it. And also, other activities may occur. Your child may perform other activities besides walking, such as going to the bathroom or walking around the house. Tip number 2 is to see your child's doctor, whether that's a pediatrician or a family doctor. It's important for your child to be evaluated, oftentimes just with a history and a physical exam, to make sure there isn't something causing your child sleepwalking. OSA, or obstructive sleep apnea, is one cause of sleepwalking. You can suspect that your child might have obstructive sleep apnea if your child snores at night, is very tired during the day, and or has episodes at night where he or she stops breathing. If you and your doctor suspect that your child might have obstructive sleep apnea, then a sleep study will be necessary, where your child is studied during sleep, usually in the hospital, and as a result of a sleep study evaluation, the number of times that your child has episodes where he or she stops breathing or where her oxygen decreases is counted per hour. If your child has mild symptoms of sleep apnea, then your doctor may recommend just trying an inhaled corticosteroid like Flonase, as well as a nasal saline spray at bedtime to reduce the episodes of sleep apnea. If your child's sleep apnea is more severe, such as 3 or more episodes of not breathing or of lowering their oxygen content per hour, then it's more likely that your doctor will refer you and your child to an otolaryngologist to have your child's tonsils and adenoids removed. Another cause of sleepwalking is restless leg syndrome, RLS. Restless leg syndrome can be suspected if your child has discomfort in his or her legs or is often moving them throughout the night. If restless leg syndrome is suspected, then a blood test looking for the level of ferritin is recommended. Ferritin is a marker of the amount of iron that your child has in her blood. And if the ferritin level is low, usually below 50, then your doctor will recommend that your child takes iron supplements. And after about 6 months, the ferritin level should be normal. And if the cause of the sleepwalking was restless leg syndrome, then the restless leg syndrome and the sleepwalking will be gone. And a third cause of sleepwalking are seizures, when in fact the child is awaking and having a seizure, and this is actually not sleepwalking, but a nocturnal seizure. Reasons to suspect a seizure disorder are if you have a family history of seizure disorder, if your child has these episodes during the day as well, and if they occur throughout the night. Usually sleepwalking only happens once a night, whereas seizures can happen often throughout the night. And usually seizures are shorter than sleepwalking. While sleepwalking can last up to 20 minutes, seizures usually last less than 5 minutes. If your child is suspected of having nighttime seizures, then your child will also get a sleep study, but in addition to the sleep study, they'll have an EEG at night, which is a way of measuring the brain's activity. Tip number 3, if you and your doctor determine that you do not have a medical cause for your child's sleepwalking, then it's very important to make behavioral modifications to reduce the chance of sleepwalking. Often sleepwalking occurs because children are not getting enough sleep. Some of the best ways to make sure your child is getting enough sleep is to have a regular bedtime, even on the weekends, and to have regular naps. Usually children need 1 to 2 naps up until age 3. At age 3, they usually are having 1 nap, and it's usually in the afternoon, whereas before then they were having 2 naps, 1 in the morning and 1 in the afternoon. After age 3, children tend to need to nap less, and by age 5, most children don't need to nap at all. Children can sleep up to 9 or 10 hours per night, and it's important to allow them to do this. If you suspect your child is not getting enough sleep, you can observe him or her in the evening. If she's cranky or irritable, then it's possible that she's sleep deprived. If she's cooperative and friendly and not cranky, then she's probably getting enough sleep. Tip number 4 is to limit the amount of beverages your child has at night and limit the amount of caffeine. Often a full bladder is a cause of sleepwalking, the cause of your child getting up. It's important to limit your child's drinks before bedtime, to have a scheduled bathroom break before he goes to sleep, and to avoid caffeine, which is not just in soda but in candy as well, chocolate as well, anytime near bedtime. Tip number 5 is to make the bedroom a place that's easy to sleep in. So it's important for the bedroom to be quiet and cozy, and absolutely your child should not have a television in her bedroom. Tip number 6, if your child is sleepwalking, it's important to not restrain or awaken her. It's not dangerous if you do awake her, but it can cause her to become upset or scared. So it's important to avoid intentionally trying to wake her. Tip number 7, if your child is sleepwalking, it's important to protect her from her environment. First of all, she shouldn't be sleeping in a bunk bed on the upper level because this can lead to a fall. In the bedroom around her, you should remove any breakable or sharp objects that she might hurt herself on, as well as electrical cords or furniture that she might trip on. You should lock all doors and windows so that your child cannot go outside. And if possible, put up a gate outside your child's room and at the top of stairs to prevent her from falling. Tip number 8. If you would like to try to stop your child from sleepwalking, even though it's not harmful, it can be stressful for the whole family. You can try scheduled awakenings. So 15 to 20 minutes before your child usually gets up to sleepwalk, wake her and comfort her when you do wake her. If you do this every night for about a month, in most cases, sleepwalking will go away. Tip number 9. If you've tried all these tips to help with sleepwalking, you've made your environment safe, and you and your doctor have explored possibilities for the cause of sleepwalking, and you haven't found any medical cause, and you're not able to decrease the frequency, and the episodes are distressing or putting your child at risk, then you and your doctor may decide to use a benzodiazepine, which an example would be Clonazepam or Klonopin. The dose is 0.125 to 0.5 milligrams at bedtime. It can be used for up to 6 weeks and is really only recommended if nothing else has worked. And tip number 10 is to believe in yourself. Sleepwalking is extremely common, up to 15% of children. And it almost always will go away within 1 to 2 years. I've given you tips on how to look for other causes of sleepwalking, how to identify sleepwalking, how to protect your child when your child is sleepwalking, and how to decrease the chances of sleepwalking by improving the quality of your child's sleep. I've also discussed a medication that can be used if nothing else is working for sleepwalking. I hope these tips have been helpful. Thank you very much for listening, and have a great day.